We're just going to touch on the special senses very briefly. They're listed here. In this image, obviously we have the eyebrow, eyelid, eyelashes. The pupil is the black center of the eye. And also we see the iris, which in this case is colored hazel. And also see the lower eyelid. And we do not need to know the other terms here. This is a great picture of the eye again, and we're going to study a little of this anatomy. Starting on the left-hand side of the slide, that would be the anterior of the patient. We have the cornea on the outermost surface, and then in from that we have the iris, and right in the middle we have the pupil in the middle of the iris. Behind that we have the lens of the eye, and then shown in yellow we have the retina of the eye, and it also is continuous with the optic nerve. The retina contains two layers. The innermost layer of the retina contains rods and cones which allow vision. These are photoreceptors. There are a few eye reflexes we should be aware of because we'll be testing our patients with some of these. Convergence is this reflective motion of the eyes medially, so towards the middle, when we focus on a closer object. Photopupillary reflex is the idea that bright lights will cause our pupils to constrict. I think we all know that. And when we're in darkness, the opposite occurs. Our pupil will dilate. The accommodation pupillary reflex is that when we're viewing closer objects, our pupils tend to constrict. Some of these reflexes are tested in our patients to ensure that they have good neurological function. We all know that the ear is used for hearing, but it's important to also remember that it has the important sense of balance. It's divided into the three parts mentioned here: the external, middle, and inner ear. The outer ear collects sound waves. The middle ear has an opening into the eustachian tube, or the other terms that are here as well. And that eustachian tube links the middle ear with the throat and allows equilibration of pressures. The middle ear also has three tiny bones or ossicles, and here are their terms: the malleus, incus, and stapes. And their function is to transmit the vibration from the tympanic membrane or the eardrum to the fluids of the inner ear. And it's in the inner ear that the sensation of hearing occurs.